Good evening and welcome. You are watching Table Talk with me, Joyeeta. On the show today, Ask the Doc. Any questions that you have about Omicron, the boosters, vaccination for your children, ask us anything over the next half an hour on Table Talk. A special guest today, Dr. Joyeeta Basu, joins me from Gurgaon in just a moment. So stay with me as I look forward to having this conversation with her to find out whether, whether the boosters are on time, what else we can do actually to keep safe, and whether we are taking this wave a little bit too lightly than we have the previous one, especially the Delta wave. So really, what makes Omicron different? What makes Omicron a little bit more dangerous than we think it is? Stay with me on Table Talk, and Dr. Joyeeta Basu will be quickly answering all your questions. Where do I live? I live between Delhi and Abu Dhabi. And the other questions, all the other questions I hope are related to Dr. Joyeeta and Omicron. But also a quick reminder that please do subscribe to my YouTube channel, Joyeeta Mohan. Some of the conversations now will be exclusively on the YouTube channel and not on IGTV, but hopefully more conversations over the next year. And please feel free to send in all your requests and feedback for any kind of conversations that you would like me to do. And yes, hopefully just gonna have a look to see if she has joined. Not yet, so bear with me, guys, as I stay with you all. There's another, I'm ending the year with an Ask Me Anything, an AMA session on either the 29th or the 30th. I'll put the time out on my story, and you can ask me anything about the year gone by, about what I've been doing, what I hope to do in the next year. And so join me live for that. It'll be an interesting casual talk, no guests, just me and you. And in the meantime, I'm hoping to get Joyeeta, but stay with me as I quickly just message her. Hi, Dr. Joyeeta.
Hi, how are you, Jyotsna?
I'm well, thank you for taking time out on Sunday. It's
Most long time. It's been 6 months.
It has been 6 months, right? And it seems like nothing has changed. Well,
absolutely. We did this peak Delta, I think, and now we are
peak Delta. Yes, absolutely. We did peak, and now we are. I don't know whether it is just peak Omicron yet or not,
no,
and I'm going to dive into that. Not yet, right?
Yeah, we are going into it head. Yeah.
So, Dr. Joyeeta, thank you so much for joining me on Table Talk. Dr. Joyeeta is, of course, one of the most popular doctors in Gurugram. Every single person who I forwarded the creative to said, oh, yes, she's my doctor. So there you have it. But more than that, she's also the co-founder and director of the Doctors Hub. And she is somebody whose voice resonates with a lot of us. She's somebody who talks, she says what she thinks, and I mean, I think a lot of it does make sense if we sit out, take pause and just listen to what she has to say. So I'm very excited to begin this show with her today. Joyeeta, I'm going to cut to the chase. Are we taking Omicron too lightly?
Thank you for having me on the show, firstly. Yes, we are. I don't think we've learned any lesson from the Delta variant. We are following COVID appropriate behavior. I think what happened during the Delta, where everybody was screaming their lungs off for oxygen, they were looking out for hospital beds, everything is now a thing of the past. They've just forgotten it, shut it tightly, and don't want to remember it anymore. But I think we are going into land into trouble again.
We are, right. A lot of people are actually dismissing it for the time being, as they say, living it day to day by saying, oh, we believe the peak is going to come later. We believe the peak is going to come end of Jan or in Feb. So, in the meantime, let's just go out.
Yes, that's what they think. But what they forget is Omicron is the transmissibility of Omicron is higher than what even Delta was. I mean, we are looking at when it started way back in 2020 Jan, that was the Alpha variant. That almost seems like it was a baby. It hardly had any infections. There were not many higher. It just affected people with comorbidities. It affected just the elderly. The Delta showed us a different picture altogether. It was affecting the younger people. It was affecting mid-30s, mid-40s. It was. It showed us what this virus could do. And I'm fearful of what Omicron can do. At present, people think that Omicron is showing up just milder disease, milder disease, and it's showing, the severity is not so much. But they forget they're seeing these are the cases that they're seeing in South Africa and they're seeing in Britain, in the UK. And these are two places, especially the UK, is a highly vaccinated population. So I would expect that the disease would be, milder in those cases. In India, we have about, I think, 40% vaccination, fully vaccinated.
30 something, not even 40.
40% vaccinated. In Gurgaon, they said 128% people had first dose vaccination. I don't even know where they come up with such a figure. But yeah, so our vaccination rates are very, very low as compared to the rest of the developed world. I'm not going to talk about the developing world or the third world countries as compared to let's talk about the developed world. So compared to them, our vaccination rates are very low. We don't have vaccination for the under 18. The developed world has started boosters. We are only going to be starting boosters next month, 10th. I don't know why we are waiting for the 10th. But yeah, so these are things that are cause for concern. These are things that worry me. These are things that I'm not comfortable with at present.
So I'm going to come to the boosters and the vaccination for the children in just a moment, Joyeeta. But I want to ask you firstly, what is it that, especially about Omicron, that is worrying you from what you may be seeing through your patients?
So at present, whatever patients I have seen, most of them are, as I said, it's a 50-50 thing. I saw, so far, whatever I have seen, about 6-7 are fully vaccinated, 4 have single doses, and the rest are under 18, so they have not got the vaccine. So far, all mild cases, like everybody says, but this is not the mild flu-like symptom. Everybody who I've met across said, this is not flu. I can make out that this is not the usual cold and cough that I get. That's the first thing everybody comes and says. I think this could be the COVID. I think this is something different because it's not my usual cold and cough that I get every year. So that's number one. Number two, the fever is high. There is a lot of chills with the fever. The cough is very severe. But yes, what do we mean by less severe? What we mean by less severe is the oxygen levels are not dropping, number one. Number two, the blood tests that we see to track how patients are doing in the disease process, that the marker levels are not coming out to be high. So I don't need to.
I lost you.
Can you hear me? Sorry.
Yeah.
I don't need to admit people in as yet. I have not needed to admit anybody in the hospital, and so that's the only way I can say it's milder. But the symptoms are not mild. The symptoms are there. It's just that the oxygen levels are not tanking as fast as it was with the Delta.
So at least there's that little bit of good news in the midst of all this. But tell me, how are the symptoms? So these symptoms vary a little bit, do they, from what we saw in the second wave through Delta?
Yeah, they do vary. So with Delta, there was a lot of loss of smell, loss of taste, loss of appetite. At present, this is purely people who come with sore throat, scratchy throat, cough, severe cough, and high-grade fever with chills. These are the common symptoms that we are seeing, and headache. These are the common symptoms I'm seeing. I'm not seeing any of the I'm not seeing any of the loss of smell, loss of appetite, or the stomach upset that was there with the Delta. Not there over here.
So there's a little bit of hope that, because we keep saying that this is a mild, this is a mild mutant in a sense, a mild variant. Would this be that the virus is self-destructing into, it keeps going into milder versions till it completely self-destructs?
So we'll have to go back to a point where, from the beginning, the alpha variant. So the alpha variant infected a lot of people. It managed to mutate when it went into a person who was immunocompromised, who was on a million of immunocompromise, on a lot of medications. And that's where that mutated, and it mutated in such a way that it converted into something which was B117, which was the UK variant. It traveled all the way to India, converted into the Delta variant, and we saw what the Delta variant did. All this, then it went to South Africa. In South Africa, again, this was another immunocompromised patient where this variant mutated, and then it converted into Omicron. All this virus needs is that one person where it can mutate and convert into a more lethal variant. It could. I'm hoping that's how we can go to a milder this, and it becomes endemic and eventually dies out. I'm hoping, but there could also be this outcome. And I read somewhere today that there could be a possibility that if it affects an immunocompromised patient, if the Delta variant and the Omicron variant, because the Omicron has not taken over the Delta in the whole world. So the Delta variant is still roaming around. The Omicron is there. If both of them together infect an immunocompromised person, then you're looking at a super bug. I don't know what to say about that, but yeah, that's something that I just read today. So again, it sounds a very idea, but I don't want to get there. I don't want to think about that at all.
So do you think that the way we're going to, we're in for a tough time? And when do you expect that tough time to really peak?
We are definitely in for a tough time, because even if the disease is mild, you have to remember COVID, the mildness of COVID is, the definition for mild in COVID is completely different from the definition of mild in other diseases. So mild does not mean you do not need to see a doctor. Mild does not mean you don't need medication. Mild does not mean that you may not progress to something which is moderate or severe. As far as how it will progress, we'll only get to see in the future. As I said, we are only 40-something% vaccinated. Our boosters haven't started. Below 18 have not got their vaccinations as yet. What we are seeing in the UK, definitely milder variant, but official figures say every 1 in 6 is infected. I have a friend who's in the NHS. She says every 1 in 3 is infected.
Oh, wow.
So it just needs to start infecting the elderly, start infecting people with comorbidities, and then those will be the people who will overwhelm the hospitals. The youngsters will not overwhelm the hospitals, hopefully, unless they have any comorbid factors. How soon are we going to see it? Gurgaon, I think last Monday, Tuesday had 26. Yesterday was 58 or something. So you can see by mid-Jan, end of Jan. By mid-Jan, mid-Jan, end of Jan. They're saying I'm calling it late, maybe. I hope I'm calling it late. I hope it doesn't come in earlier. I hope it starts till people start. I hope people get vaccinated, get their boosters before that.
Are we late on the boosters?
Most definitely 100% yes. We should have started the boosters November. We have the vaccines. There's no shortage of vaccines. Mr. Adar Poonawalla has said that he's going to scale down on vaccine manufacture because there were no orders from the government. So we have the vaccines.
And the fact that this is only for, those with comorbidities, over 60, frontline workers, what about the rest of the population? And I'm not even talking about the children just now. I mean, there's that middle generation like mine that is, the one that is all up and about.
Yes. So it's going to be tough for them. So people have been talking about, how vaccines don't work. Let me start with that. How vaccines don't work. You have to remember, first thing, that the vaccines were produced keeping the alpha variant in mind. Okay? They were manufactured keeping in view with the alpha variant. Then the Delta variant came, but the vaccines worked quite well against the Delta variant. Okay, the vaccines worked very well. Now we need to tweak the vaccines against the Omicron. When that will happen, I don't know. But the vaccines still work. The vaccines efficacy wanes over a period of time. That's what we are seeing. Research has shown that a lot of studies have shown that the AZ vaccine that India has full of. Let's not even get into mRNA, which I personally think are the best vaccines in the world. But the AZ vaccine wanes over a period after 5 to 6 months. So most of the elderly, most of the people with comorbidities had their second dose way back in June, July. We are already 6 months down the line. So we are already running late. And that's the people that we need to protect. And now we have Omicron, where vaccine efficacy may not be as effective as it was with the Delta and the Alpha variant. So so you need another dose of it. That's why the boosters. I don't know why he's calling it whatever he's calling it. I'm going to call it the boosters.
Preventive. We'll stick with boosters.
We'll stick to boosters. Yeah, that's more scientific. Yeah, so that's what. And I believe there are studies and research being done to tweak the vaccines to so that they can be more compatible with the newer generation, newer variants. So yes, till we don't have something, these are the vaccines that we have, and they will definitely help. We started off with the vaccine efficacy is going to be 70% against the Alpha variant, but that vaccine efficacy of 70% really held up against the Delta variant, and I'm quite sure it'll hold up against the Omicron variant too.
So the concern, is there a concern in the medical fraternity that, a lot of people are dismissing the vaccination per se, because, they're reading things like, okay, so vaccine isn't working with Omicron. So, in a country like ours where there's such huge hesitancy in any case, I mean, do you think a lot of people, it will just put people on the other side again? It's a negative. I mean, instead of understanding the fact that any kind of, vaccination will at least help you to not definitely be hospitalized.
Yes, absolutely. And that's what when people have told me about, I have a tie-up with the pharma companies and I have a tie-up with Pfizer because I've been talking about mRNA vaccines and all. It's not that. It's not that. Our only hope to end this epidemic is the vaccines. Once we vaccinate every person in the world, that's the chance to end this pandemic. There's no other way. Every time this virus gets a chance to infect a person, it gets a chance to mutate. Every time it gets a chance to mutate, a new variant comes which is more stronger, more lethal than the previous variant. We have more trouble in our hands. So you need to vaccinate. Also, you have to understand, vaccines were manufactured in record time. It was called speed warp or whatever. It was manufactured in record time. They will have certain side effects. Yes, you will have the chills, fever, etc. You will have certain things. Everything has pros and cons, but it has stood the test of time so far. You just have to give us more time. We don't have time. This is a race against time, because every time we think we are winning, the virus gets 2 steps ahead of us, 3 steps ahead of us. So we need that time. We need to buy that time. And we are tweaking the vaccines. But till that time, we need every single person to get vaccinated. If you're vaccinated, you need to counsel your family members and your friends who are anti-vaxxers, who may not be anti-vaxxers, who may just be scared that, no, it's fine, please take a vaccine, any vaccine. If you're scared of a live vaccine, which is the Covishield, go for the dead vaccine, which is the Covaxin, which has lesser side effects. I mean, maybe the efficacy is a little lower, but go for it. Go for something. We need to get vaccinated. We need everybody on the planet to get vaccinated.
So I'm going to start taking a little bit of questions in the middle, Joyeeta. Do you see people getting a vaccine booster every 6 months until COVID variants die down?
So I think now how the vaccinations schedule, the dosage schedule for the vaccine will be, you take the first dose, about 6 weeks later, you take the second dose, about 4 months from the first dose, you take your third dose. So that's your 3-dose schedule. And then every year you take a booster. That's how it's going to be. It's not, the third dose is not a booster, it's a third dose. And then 6 months after your third dose, you will be needing a booster every year, which will be tweaked. Like the flu vaccine every year, people take it every year. And it's tweaked according to whichever flu virus is roaming around. That way, this vaccine will also be tweaked.
So basically, it's part of our lives now going forward.
Yes, it's going to be part of our lives. We asked for it. We troubled it. People don't talk about climate change and don't believe in climate change. But this is precisely because that's a different thing altogether. But yes.
I'll get you on that as well then. Next time. It's always good to hear another side to the docs.
Yes.
But Hospitals are organizing private camps because they have vaccines in stock that will expire soon. Should we get
Yes,
booster shots at a private camp?
yes, yes.
There you
In
go.
fact, I
Yes.
know people who know somebody in some hospital who are already going and have got their booster. There are a lot of
So
my
a
friends
lot of
have got.
people are doing the whole jugaad, right? I
They've
mean,
all got
behind
the
the
shot.
scenes with.
They've already been told, we'll update your COVID status when it becomes whatever. So I'm happy. I'm just happy that they are taking the vaccine thing seriously. They're taking the health seriously and they're going ahead. I'm not
Yeah.
unhappy. I'm very happy about this. Go ahead. Any which way you can get a booster. Why wait for the 10th? What are you waiting for, Chris? Christmas is gone. I don't know what's on 10th.
Next
I don't
Christmas.
know. 10th of
At
Jan.
the rate we are going.
10th of Jan. Somebody's birthday, somebody's
Yeah.
anniversary. So,
Yeah,
sorry.
it's a bit random, right? The
It's,
10th of Jan.
they should do
What
it
what
tomorrow. Today.
what is the rationale behind it? Is it because you have to suddenly get the stocks going, which is not a problem. We already have the stocks.
We have the
So
stocks. They're expiring. We have the stocks.
yeah,
We have the stocks. There's nothing that we don't have. We have the stocks. We should be. I don't understand much about this government, so I'm going to let that pass.
I'm going to let that pass as well. So will Covaxin work at least with serious disease?
Yes.
There you go. And another question earlier, supplements for immunity. Anything that you suggest to, I
Vitamin.
mean, I think we've been asking this question again and again, but
Vitamin D. So I have so with supplements, I usually tell all my patients vitamin D is the one supplement that everybody should be taking 60,000 every week in case you're in a
oh,
deficient range, and if you're in a range which is in the normal, so take it once a month. Number one. In the winters, maybe you can take it more often. If you're comorbid, if you're above the age of 60, check your levels of vitamin, and then you can take those vitamins B12, you can take your vitamin D, you can take a vitamin C in the winter months, you can take that. Otherwise, everything else you can get from your diet.
so what about children? Do we give them vitamin D as well
Yes, you
right
should
now?
get them tested, and you can give them if they're deficient, and if they're not deficient, maybe once a month a dose of vitamin D. In the winter. In the summer, they should be going out and playing in the sun and getting,
Right. Hopefully, as they say,
hopefully,
inshallah,
in the
next year.
winter.
But tell me, with Omicron and children, are you seeing cases of kids
Yes,
getting it now?
yes, yes. We did
It,
see cases of kids getting it with the Delta variant
Delta.
and with
Yeah.
Omicron. Yes, yeah.
So what's your take on 15 to 18, only 15 to 18 getting the vaccination right now? I mean, when I had suggested this on Twitter a while back that children need to be vaccinated, I was highly abused by a lot of people saying that, why don't you get your own children tested, vaccinated, and we don't want to risk it with our children. And I did tell them that my children are vaccinated, 13 and 9. So I'm preaching what what I do. But 15 to 18 was a number I didn't see coming. I mean, I was hoping at least they'll go down to 12.
12. Yeah, even I thought they would go down to 12 because, uh, I mean, above 12, they get many other. Again, I don't understand this government, so let's not get into it. I think they should give it to anybody above the age of 10. They should be giving
And
it to everybody above the age of 10. Either they've not done their research or they don't have enough data. So then you should get vaccines where you have data. Pfizer, you have the data. Moderna, you have the data. Get
I
those
was just going
vaccines.
to ask you that.
Those,
Yeah.
those companies have been knocking on our doors since last December. Pfizer came knocking last December. I don't know what we were waiting for then. And I think that's trouble. And I think Moderna, they approved sometime in September, October. So I don't know what's happening with that either. I heard they had approved. So then
I was going to
Dr.
ask you that. Yeah.
Yeah, so
That
I
big
did hear
hesitancy.
something about Dr. Call saying that they said they would give us 78,000 doses and not more than that. And okay, 78,000 doses, fine. That would be about 36,000 children getting the vaccine. Something better than nothing. And then they said they promised us some more in 2022. So we are in 2022 now.
Yeah. No, I think people should have been given the choice. But again, like I said, that's my opinion. If you want to get a Pfizer for
Yeah.
your child, at least have the option to get it. So I think it's been baffling, the lack of choice since COVID hit us. Everything has been wait and watch and wait while the world goes ahead. CDC has gone ahead with Pfizer for children, and even under 12
Yeah,
at
we're,
this
we're
point.
doing five from five onwards.
Yeah.
So we can give from 10, 12. Yeah, we can.
Yeah. Should we do a vaccine cocktail as a booster?
Yes.
Okay. And
Again,
how?
again. So vaccine cocktail as far as India is concerned, and on the whole global picture. So vaccine cocktail, ideally the vaccine cocktail should be, since most of us are vaccinated with Covishield, we should be boosted by an mRNA vaccine. We don't have an mRNA vaccine, so then what are your options? So I've read a study which said that a third booster with Covishield also shows efficacy against the Omicron, and it boosts up the immunity by almost 75 to 80%. So yes, there you go. What about people who were allergic to Covishield? What about people who did not react well to Covishield? What about people who are immunocompromised, because this is a third life vaccine that you're going to be getting? Then yes, you can add a booster with Covaxin, but there's no study that I've seen where it shows they're showing any study which says combine these two vaccines. So I don't know about that, but ideal would be the Covishield with the mRNA vaccine. That would be most ideal.
It doesn't look very,
No,
that doesn't look like it's happening, at
dose of
least in
Covishield.
the
Then
future.
your third dose of Covishield.
Yes.
Yeah.
So how can we differentiate between a normal throat infection and COVID? Is it advisable to get a COVID test every time one is coughing?
At present, when the cases are peaking, in fact, if I'm seeing about out of 10 patients, if I see 8 patients and they turn out to be COVID, then I would send everybody for a test. Yes,
You would. And
everybody
do
should.
they, my question on that, if someone is coughing and you test once, and do you need to go back and test and you're fine and you're still coughing a couple of days later, do you need to go back and test, or it's,
Yes, you should
yeah.
go back. So the RT-PCR, usually they say anywhere between the third day to the fifth day. So it should come, but sometimes you do get a false negative. So we would repeat the test, especially if you find the patient is continuing to cough, oxygen levels are falling, or the blood test that you do is showing signs of severe disease. Then yes, I would send them back for a retest.
So tell me something, is our medical fraternity, after the big second wave, has it kind of recovered enough to handle what is possibly coming our way again?
So I remember telling this, that 6 months down the line, all of us are going to have PTSD. And
Yeah.
many of us do. I know many people who've dropped out. I know many who said they're not going to be treating COVID any longer. But I think we are a resilient lot. And I mean, we couldn't be doctors if we weren't resilient enough.
Yeah.
So we are back
Yeah.
to treating, and yeah, we are still around.
Well,
We
I
are still
hope it
around
doesn't get back.
in the future, but we are still around. Yes.
Well, I hope it's not as bad as it was the last time I spoke with you and to the other doctors. It was just, I have no words actually for that phase actually. Will it be advisable to get the third dose even if the viral load is high, since the numbers are rising?
Viral load. I didn't understand your question. Viral load is.
Shibani, do you want to just elaborate on that question? In the meantime, could you please repeat the duration of the gaps between the shots and the booster?
So the duration of gap between the shots, what they are saying at present is, if your second dose was 4 months ago, get a booster.
This one's for you. Can't doctors help those of us who don't have Jugaad?
You have to know doctors in big hospitals. That's the only way I can tell you. But typically, what I see is, go to the vaccination center, go around 3:30, because everything closes at 4. They have unopened, unused vials, leftover vials. They might just give it to you. They are giving it, so they might just give it to you. That's the only jugaad I have which has worked.
So go, give it a shot, guys.
Give it a
Um,
shot. Give it.
I mean, there's nothing to lose, right?
There's nothing to lose. Absolutely nothing to lose. Wear an N95 mask.
There you go.
Wear,
I've
wear
been
your
telling everyone that.
wear
Yeah.
your mask, well-fitted mask. Make sure that your mask is well-fitted over your mouth. Yeah.
Are those cotton masks of any help?
Cotton masks. Okay. Then you need to have many layers.
Double.
You have to make double, triple, maybe with the Omicron. Double was with the Delta. With the Omicron, maybe triple, maybe
Okay.
4. So I think one N95 should be good enough.
Another question I wanted to ask, but before that, is a booster the same formulation as the vaccine, or is it different?
The same formulation. The dose may be a little less. I don't know what in the Indian government ICMR is suggesting as far as the uh, dosing of the booster. I know for a fact that Pfizer and Moderna are giving half the dose of what they gave in the first 2 doses. So, and I don't know what they're planning with the Covishield.
And where do we stand with genome sequencing? Is it very tough to figure out that Omicron is the one right now, and we're when patients are testing positive?
For genome sequencing, it's difficult to sample. It's difficult to send all the samples for genome sequencing. That's why I tweeted that you do the RT-PCR. All RT-PCR tests have to have that S gene testing kit, because this shows S gene escape. And the moment you see that, you send those particular tests for genome sequencing, you have a better idea of what's happening.
And isn't vitamin D 1000 IU every day okay if someone has normal levels?
If your vitamin D levels are normal, 1000 IU every day is perfectly fine. If your vitamin D is lower than the range, then it should be 60,000 once a week.
Also, what is the difference in the symptoms between a normal throat infection and Omicron? And when is it advisable to do the RT-PCR?
It's advisable to do the RT-PCR on day 3, day 4. That is the advisable day to do. Before that, you can do a lateral flow test or a rapid antigen home test, because those pick up the virus more quickly. But there are many false negatives over there, more than false positives. So even though you may have a false negative, your symptoms persist, go do RT-PCR. What are the typical signs and symptoms of the Omicron? Scratchy throat, headache, high-grade fever, chills, and backache. That's typically the symptoms that we are seeing at present. This time, no loss of smell and no loss of taste. Not with the Omicron.
Like I said, we take the good news wherever we get it. Someone's asking, if I can't avoid a travel, what are the precautions I can take? I know you also tweeted about the fact that don't immediately take out your masks when you get on a flight. That's important.
That's important. So if you have to travel, wear your N95. Definitely an N95 and nothing else, or a 2-layered, 3-layered, whatever mask that you can wear. Do not remove your mask while you're at the airport. Do not eat or drink anything in the airport. If you're dying of thirst, go far away from any person, go as far as you can, but I would say avoid removing your mask. When you get onto the flight, as long as the flight is stationary and not airborne, the HEPA filters are not on. They are connected to the air conditioning. The HEPA filters, this I learned today, the HEPA filters are connected to the air conditioning. They don't use the air conditioning on the flights, inside the cabin. The air conditioning comes from the airport, from the aero bridge, from the airport into this. That's what is mandated, I believe. So they don't have the air conditioning on. It's only when the flight is about to take off, that is the time when they turn on the air conditioning. Once they turn on the air conditioning, the HEPA filters are on, then it's safe. But I would still say, if it's a short haul flight, please do not remove your masks. If it is a long haul flight, if there is a passenger sitting next to you and you want to eat and drink, just request the passenger, keep your mask on, because I would like to eat or drink something. Or you allow them to eat and drink first. You be the good one. You allow them to eat or drink, keep your mask on. And once they've done, just request them politely that you finished eating and drinking. Please keep your mask on so that I can remove my mask and I can have my meal, or I can have my drink. And that's the only way to go about it. Ideally, short haul flight, don't eat or drink anything. Keep your mask on. Long haul flight, yeah.
It's also, a tough one.
You're using the if you're using the lavatory, do not remove your mask. Whatever you do, do not remove your mask. You may think you're in a place, you're alone over there, but the previous person, if he's removed his mask, if he's coughed or whatever, it's an enclosed place, enclosed space. The virus may be inside the. Even though there are HEPA filters there, whatever, I would just say don't remove your mask anywhere in a closed environment.
Yeah, and keep mask up,
Keep
right?
the mask. Keep the mask.
Yeah, yeah. Should we do antibodies testing? I'm quickly going through a couple of questions and ending it.
You can do antibody testing. A lot of patients have had antibodies to a spike antigen and to a whatever to the previous variant, but they still got Omicron.
It's still happening, isn't it? Two doses down, twice down, booster
But it's
down, Delta
efficacy.
down.
Yeah, vaccine efficacy wanes over a period of time. Over 4 to 5 months, it wanes. So you need that third dose. It's not even a booster; it's a third dose.
God help us all. I think it's a long way to go for many of us. It's a bit of a bummer, as they say, especially for people who are ready to get it.
It's
and are not
sad
being, yeah.
because there are people, because of certain strata of society, who do not want to believe in the severity of the virus, who don't believe in masks, who don't believe in vaccines. The rest of the world has to suffer, but that's how it is.
So Shibani is back just before the second wave. There were videos circulating to delay getting the second shot since the number of COVID positive patients was very high.
No, maybe because I think that was because they were getting it because there was no people were not well masked when they went to the vaccination center. Number one, number two, there was no distance being maintained. There was an overcrowding of that space at that time. So I think now lesson learned. Wear your mask properly, make sure there is a distance between the two. There are now drive-through vaccinations where you don't even have to get out of your car. The people are just coming in. I hope the drive-through vaccination happens. In Gurgaon, the condominiums are holding the vaccination. So if they have something like that, and you ensure that there is a gap between, there's a distance between the two, you maintain social distance, should not be a problem.
Okay, a couple of questions, and I promise to let you go. Covishield recommended for young adults, or should they go for Covaxin? Whatever you get.
Tough question. So, this is a tough question. We don't have a choice. So first of all, we don't have a choice. Let me go about this way. We don't have a choice. What choice do we have? We have only Covishield in our hands, so go forward for Covishield. Number one. Number two, if you have comorbidities, even young adults can have comorbidities. If you're immunocompromised, if you're on medications, certain medications, check with your doctor and then go forward with Covishield. That's my advice. We don't have much of a choice. So my advice: if you're healthy, you're fine, go ahead with it. If you are immunocompromised, if you have comorbidities, if you're diabetic, if you have any other issues, check with your physician and then go ahead with this.
And should people with 2 doses of Covaxin take a third shot of Covishield or Covaxin?
Again, whichever they get, but mixing and matching they're saying mixing and matching works very well. So maybe a Covishield, unless there's any contraindication to the Covishield.
All right, I'm going to end it here because there are many more questions, and I will keep going and keep you away on your Sunday, because I know how precious that little bit time is, although I don't think you take any time out anyway. But what's your last word out to people out there? How to keep going through Omicron and to be safe?
Last word, first of all, mask. Wear your N95 mask. Stay in a well-ventilated area. Ventilation is very, very important. So if you're partying, if you want to party out in the open, it's very cold, but it's safer outside than indoors. 3, get vaccinated. If you're not already vaccinated, get vaccinated. Get your booster as soon as possible. And 4th, maintain distance. 5th, less number of people there are in a particular place, the better would be. 6th, most important, which India doesn't do and many doctors don't speak about, is getting the home kits. If you're going out 2 hours prior to going out, do a home test. If it shows positive, do not go. Do not infect others. Number one. Number two, if you're unwell, miss the party. Don't go out and infect others. If you're unwell, if you're coughing, if you have a fever, you have a slight scratchy throat, do be kind, and be good about this. Don't go out. Stay at home. Even though others say no, come, nothing will happen, etc. Don't get into peer pressure. Don't go out. Stay at home. So I would suggest these are my few pointers about
How to keep going
and prevent it from spreading.
No, number 6 is very important. I've always said
It
that,
is very,
COVID has not been just about us. It's been about our community. It's been about people all around us. So, well, we have all kinds of people, but hopefully people will listen to you. They all listen to you, Dr. Joyeeta. Thanks
I
so
hope
much.
so.
No, I can tell you they do. But thank you so much for taking the time out and answering all those questions. And my apologies to all those people whose questions we've not been able to answer, but this has already gone over by 15 minutes. So please this is it for today. Thank you so much, Dr. Joyeeta, for being
Thank
with
you
me
for
on Global
having
Talk. I hope that there is not another variant that we, come back again 6 months later. I hope this is it. And we're done. And we just talk about good times later. Thank you. And thank you, everyone, for joining us. Goodbye and be safe. Bye.
You too. Bye.